is 22 people, 22 service members dying a day with issues associated with prescription medication abuse, but really suicide, but oftentimes using prescription medications and oftentimes pain is a component. A more accurate statistic is probably 1.5 people a day, but really, is that any less horrifying? And so there's a real intensity on wanting to change the culture. And that's what I think we need to do. But from a DoD perspective, I'm always being asked, well, you're providing us all these tools, who else is using them? And so my challenge to this group going forward is, please help me communicate this to the leaders in the DoD and the VA and federal medicine in general, that these things are important and need to be paid attention to. It's much easier if Congress is telling us to do things than if Dr. Buckenmeyer is suggesting we do things. And that's kind of where we're at right now. The video I'm about to show you sums up this culture change that we're trying to make both in our patients and our providers. So without further ado, we'll all cross our fingers and hope this actually works.
Everyone agrees that pain is a universal human experience. We now know that a person's pain experience is 100% of the time produced by the brain. This includes all pain, no matter how it feels, sharp, dull, strong, or mild, and no matter how long you've had it. You might have had it for a few weeks or months. This is called acute pain, and it's common with tissue damage, say from a back injury or ankle sprain, and this is a normal and sometimes a protective response from your body. And generally you'll be encouraged to stay active and gradually get back to doing all your normal activities, including work. Or your pain might have lasted for 3 months or longer, and this type of pain is generally called chronic. And with this type of pain, tissue damage is usually not the main issue. What's often less clear, though, is what you should be doing when you're told you have chronic pain. Well, in the United States, chronic pain is a really big problem. 100 million adults, that's 1 out of every 4 people, have chronic pain issues, and this can be extremely frustrating. Having a brain that keeps on producing pain, even after the injured body tissues have healed, is no fun. Those with chronic pain say it still feels like there must be something wrong. This presents a real challenge for them and the healthcare providers who are trying to help. For most people, once anything dangerous is ruled out, healthcare professionals can explain that most injuries in the body are healed, as well as they can be, by 3 to 6 months. So ongoing pain being produced by the brain is less about structural changes in the body and more about the increased sensitivity of the nervous system. In other words, it's more complex. Well, to try and figure out what's going on, you need to see how you might retrain the brain and nervous system. To do this, it's helpful to look at many of the things that affect the nervous system and may be contributing to your individual pain experience. What can help is to look at chronic pain from a broad perspective. And by using a structured approach and a plan, it's less likely that anything important will be missed. Let's begin with the medical side. Your healthcare providers will likely ask you to rate your pain level on a 0 to 10 scale. While it's natural to focus on getting your pain as close to 0 as possible, it's equally important to pay attention to how your pain and the treatments used to manage your pain affect your function and things like mood, stress, sleep, and activity. Initially, taking medications, as directed by your healthcare provider, can help, and then usually they can be tapered and eventually stopped. However, it is usually the more active approaches that are necessary to retrain the brain, so your healthcare provider might recommend you also try other complementary treatments for your pain, things that might help keep you moving, such as physical therapy, acupuncture, yoga, or massage. Some people feel that surgery might be the solution for their pain, but when it comes to a complex problem like chronic pain, surgery is usually not the first answer. It's best to talk to your primary care provider to consider everything that could be contributing to your pain and what treatments are best for you. Next, it's also helpful to consider how your thoughts and emotions affect your nervous system. Pain really impacts on people's lives. and this can have a big effect on your mood and stress levels. All those thoughts and beliefs are brain impulses too, but you can learn ways to reduce stress and wind down the nervous system. This helps with your emotional well-being and can reduce pain as well. The third area to consider is the role of diet and lifestyle. Now, it turns out that our modern lifestyle might not be so good for us. In fact, what we eat and how we live may really be contributing to a sensitized nervous system. Looking at all the things, like smoking, nutrition, alcohol, and activity levels, and seeing if there are any issues is a good beginning, and these things can go on your plan. Then, there's often enormous value in exploring the deeper meaning of your pain and the surrounding personal story. By stepping back and looking at all the things that were happening around the time the pain developed or increased, many people with pain can make useful links between a stressful period of life and a worsening pain picture. For many, recognizing deeper emotions can be part of the healing process. Last, but by no means least, is physical activity and function. From the brain's perspective, getting moving at comfortable levels without fear and where the brain does not protect by pain is best. And you'll gradually restore your body's tissues. So, to sum up pain, it comes from the brain, it can be retrained, and when looked at from a whole person perspective, you can often find new ways to heal and manage your pain. So, make sure you're doing your part. Get a helping hand if you need it. Set your goals and continue living your life.
So, simplistic, absolutely. Does it cover a lot of concepts that we've been talking about here today? Yes. Does it reset, hopefully, what patients are thinking when they go to see primary care? That was the intent. It does sum up the direction that we're trying to take the entire community. This is available for use today. In fact, it's playing in a lot of waiting rooms right now throughout the DoD. And it's part of what we call the Joint Pain Educational Program.